Abdellatif, consultant of nephrology in Australia, talk about the herbal therapy, chronic kidney disease.
Thank you, Mr. Chairman. And I would like to thank Dr. Magdi Sharawi and the organizing committee for inviting me today. And today I'll be talking about the herbal medicine and the chronic kidney disease. Just having a quick look and a quick search on the internet, I found hundreds of products that are dealing with the kidneys are promoted for being beneficial for the kidney, either cleansing or detoxing or list of benefits and herbal effects and benefits for the kidney. So the use of alternative medicine is now highly prevalent worldwide. This is so because of lack of access to maybe lack of access in areas to the medical services, and maybe it's lack of trust in the conventional medicines. Also, because they are considered to be natural, so they are considered to be safe in comparison to the other products that are considered chemicals. So to define the term complementary and the term alternative. So these are these are products that are used outside the mainstream of the conventional medicine. So complementary, if this product is used together with the conventional medicine, and the term alternative, it is used instead of the conventional medicine. So the alternative or the complementary medicine can be the herbal or can be other medicine practices like the yogas or like acupunctures or such. In this presentation, we will focus on the natural products and herbs. If we look at the global natural product market, we find that it values about $110 billion in 2013, and it's expected to reach $180 billion by 2020. So actually, it's a huge market. The commonly used natural products identified in these products were the fish oil, the glucosamine, probiotics and prebiotics, the melatonin, coenzyme Q10, echinacea, cranberry, garlic, ginseng, ginkgo biloba, green tea extracts, and the milk thistle. The main problem of those products that they are categorized under the category of food, not drugs and not medicine. So all the standards are not really applied on those products. So there is lack of standardized adverse events reporting system, as well as neglecting to report natural product use to their healthcare professionals. And the toxicity profile of the individual botanical is usually not well established. In 2013, in the annual report of the American Association of Poison Control Center, they noted that there was about 39,000 natural product-related exposures reported to them. The problem with these products that the natural products are not always marketed in their pure form, and instead they're always a mixture or a combination of a variety of other natural products. So this makes it difficult to identify the cause and effect relationship between an individual natural product and its specific toxicity. Nephrotoxicity can be in different and variable ways. We'll start with talking about the nephrolithiasis that could be related to the natural or the herbal products. Actually, several natural products have been theorized to increase the risk for kidney stone formation, but no case reports really exist. Caffeine has been shown to increase the calcium oxalate excretion. Parsley leaves, cabbage and spinach leaf will contain high concentration of oxalate, so theoretically those could increase the incidence of kidney stones in some patients. Talking about parsley, because there are many people, many advertisements about the parsley drinks and its benefits. Yes, it's a beneficial herb. It's full of vitamin A, C, and K. The parsley is high in nitrates that helps to dilate the blood vessels, which improve blood flow and help in lowering the blood pressure. Parsley also have been shown to have anti-inflammatory properties due to its antioxidant, including the flavonoids, carotenoids, and vitamin C. The anti-inflammatory properties of the parsley, along with its ability to regulate the urinary pH and to reduce the blood pressure, may help to keep the kidneys healthy, and also they may lower the risk of kidney stones. Yet, as we have mentioned, that it's relatively high in oxalates, and this could increase the risk, the kidney stones in some patients. Also, it has each 100 grams of parsley have about 550 milligram of potassium, so this should be taken cautiously in patients with chronic kidney disease. Moving to herbs and AKI, many herbs that have been reported to be a causative factor or causing a reason for AKI, maybe the aristocolic acid, one of the Chinese herbs, have been reported several times with its toxic effects to the kidneys, and the licorice also leading to AKI. So in this article, the renal toxic ingredient and their toxicology from the traditional Chinese medicines. The renal toxic traditional Chinese medicines, there are many ingredients could be leading to renal toxicity. And there are some poisonous components like the aristocolic and alkaloids, glycosides, and anthraquinones, like we have mentioned. The high dose of the renal toxic traditional Chinese medicine can cause immediate degeneration and necrosis of the renal tubular epithelial cells. Also, on the long term, use often results in chronic renal interstitial fibrosis, leading to acute chronic renal damage. There have been some reports. There is another herb, another product that's sold over the counter, which is called the Vitex. This Vitex, it's the Vitex Agnus castus fruit, known as the Chasteberry, and it's mostly common for the premenstrual syndrome, for menstrual disorders, infertility, acne and menopause, and it's known here in Kaffa Mariam. There are some reported cases, few reported cases of developing rhabdomyolysis following the ingestion of this Vitex. Now, this is a 36-year-old African-American lady with no past medical history. She developed severe bilateral thigh 4 days after she started the Vitex, and this occurred only after mild to moderate exercise, which is her regular exercise, and she stated to be well hydrated on that day. And she was diagnosed as rhabdomyolysis. So Vitex might potentiate the muscle damage with exertion, even with a normal routine exercise. So it has to be taken cautiously and watched in patient exercise. The wormwood, which is very common, and it's used for mental clarity, for relaxation taxation for as an antioxidant, and also has been reported to be the cause of rhabdomyolysis in some patients. Paliroyal, which is one of the many, has been also cases reported for hepatic adrenal lesions. And this is a CKLS, one of the products that helps with the colon, with the kidneys, with the liver, and with the spleen. And as you see, there's ingredients, it's about 10 ingredients in this oil. And there were some cases reporting acute allergic interstitial nephritis following the use. And of course, with the 10 ingredients that we have, it's very difficult to identify which one of them is the real causative of the interstitial nephritis. Shale regime, it's weight-reducing herbs, can be also used as laxative, and it's very much used, extensively used here in Egypt. So if you look at its ingredients, it has 20% Cichorium intibius and Cassia angustifolia and 50% of Funiculum vulgare. Actually, there are some studies that it's on its annual studies that showing that there was a rise of the creatinine, the orange bars, rise of the creatinine in the models using this Funiculum vulgare or the fennel seeds, and the level of the creatinine was increasing with increasing the dose of it. So it has to be used cautiously, especially in the patients with any kidney dysfunction. And these are some list of reported cases with different herbs that could be causing direct or immune-mediated nephrotoxicity, rhabdomyolysis, induced nephrotoxicity, and hepatophilias. Herbs in the chronic kidney disease patients, there are many studies and many promising studies on herbs that could be used in the chronic kidney disease patients, and we start with the curcumin. And there are studies that shows that curcumin markedly reduced the renal morphological damage and histopathological markers in the inflammation of fibrosis and apoptosis. It also reduces the adenine-induced hypertension, the albumin, and the inflammatory cytokines, where it restores the plasma sclerostin concentration, lower oxidative stress in renal homogeneity. Also, the curcumin mediates the regulation of the intestinal barrier function. This helps, and it works through decreasing the LPS lipopolysaccharide and preventing their entrance to the blood streams, and this decreases the inflammatory states. The antioxidant supplements in the renal replacement therapy, is there any evidence? So if we look at the list of the antioxidants that we have a huge list of endogenous and exogenous supplements, antioxidant supplements, vitamin B, vitamin E, C, N-acetylcysteine, polyphenols and flavonoids, L-carnitine, the green tea, curcumin, and statins, omega-3. So a number of exogenous antioxidants have been suggested to ameliorate the oxidative stress in the dialysis patients. Curcumin has shown the ability to remove free radical directed by donating hydrogen ions and therefore neutralizing them, and it upregulates indirectly the expression of the antioxidants enzymes preventing oxidative. This was a randomized double-blind study on 50 stable hemodialysis patients who were randomly divided to either treatment with curcumin or placebo, and they were taking 1.5 grams per day. And compared to placebo, the therapy of curcumin resulted in significant reduction in the serum MDA and upregulation of the antioxidant catalase activity and concentration in the erythrocytes. Also, double-blind placebo-controlled randomized compared to placebo daily oral administration of just 500 milligrams of curcumin for 2 months, and it showed significant decrease in the plasma MDA level and increase in antioxidants, glutathione peroxidase and catalase in RBCs in cohort of 45 maintenance patients. Besides its antioxidant properties, oral supplementation of curcumin in hemodialysis patients showed suppression in the chronic systemic inflammatory mediators, and subsequently might protect against inflammation-derived oxidative stress in these patients. The activity of turmeric or curcumin can be intensified by using other products like black pepper and cayenne and ginger and the plant-based nuts. But still, we have to be cautious using those herbs, especially if you are using them with a high dose and using them in patients who are receiving other medications like this gentleman who is a 56-year-old patient with a liver transplant and who presented to the ER with worsening of his edema and elevated creatinine level, and he was previously doing well, and his tacrolimus level was within the desired range. And on admission, his tacrolimus level was elevated up to 29. So with revising all the medication, all what he has been doing, the only thing that was found that he was recently taking high doses of curcumin with his food. The gum arabic also has been shown to reduce the C-reactive protein even with low doses, and it showed to improvement of renal function and to ameliorate systemic inflammation, oxidative stress in the diabetes and chronic kidney disease induced rats. حبة البركة, or the black seed, thymoquinone, which is the active metabolite, it has antioxidant and anti-inflammatory effects. It protects against the ischemia reperfusion injury, and also it has the anti-diabetic role that can help with diabetic nephropathy. However, all well-designed clinical trials in humans are required to confirm these effects. So we always have to revise with our patients what herbs they are taking, and those are lists on the National Kidney Foundation with the herbs that are high in potassium, herbs are high in phosphorus, and the other herbs that should be avoided for the patients with chronic kidney disease. Herb-drug interaction has always to be kept in mind, especially with transplant patients, especially with the herbs that are known to affect the cytochrome B40, like the St. John's wort. And also, we have always to consider the adulterants and the contaminants of those herbs. So if you're using the natural herbs, just the dried herbs, those could be contaminated even with heavy metals during their growth and during the process of their cultivation. And those herbs could contain some heavy metals like mercury, lead, and arsenic, and this could be the cause of a kidney insult. So to conclude, natural products are generally viewed as safe and effective alternatives to prescriptions or non-prescription medications. The lack of standardized policies and regulation complicates the use of natural products. It's imperative that patients comprehend the potential dangers associated with consuming natural products, especially when done without consultation with a healthcare professional. The potential for damage to the kidneys from natural products is a real concern. However, most of the evidence were from case reports which do not prove a definitive case and effect relationship. Information on dose and duration of using those herbs are often missing, and the present data are not fully conclusive, but thus warrant caution and close monitoring, especially in patients at high risk for renal dysfunction. Thank you.
شكرا دكتورة دينا. We move to next